Worried your child might not be developing like others? Here's what to look out for, straight from a behavior expert.
Okay, Miss Asha, the first thing I want to know, what are the early signs that can be identified in my child that he is on the autism spectrum?
See, the first thing is we have to look at the limited eye contact. If the child is having limited eye contact, that is one of the early signs. And any type of repetitive behaviors, if there is any type of hand clapping or any of those repetitive behaviors, that is another sign. Always I tell the parents, you have to be really focusing when the children are growing in the early years of life, whether there is any type of regression. Regression is always a warning sign for the parents. The child is having a normal developmental pattern, and all of a sudden that you can see that, he loses some of the skills which he already achieved. Or, he stops at one phase. It is always something which we need to be really worried about. And if they are not, sharing the emotions, or, they are not having that social smile, we have to be really, taking care of those areas as well.
Okay, if such signs are there in my child, if I identify or suspect, what is the first step as a parent I should do?
So, the first step is the screening. We have to do the screening just to make sure that the child is not having concerns. Many parents, they tend to do the wait and see approach. They wait to see whether the skills are coming in or not. So what I advise the parents, you do the screening. There is concerns, definitely they will help you to identify that, because early intervention can bring in a lot of difference for our children, and that is very important. So don't wait for the child to develop by himself. It's always better to do the screening.
How does ABA therapy actually works?
ABA is structured and goal-driven. So what we do, we break the goals into small steps and teach them using the positive reinforcement. Sessions will be based on the individual education plan, which will be tailor-made for each child.
What skills can we develop through ABA?
See, most of the skills, it can be achieved through ABA therapy. Initially, we'll be working on developing the communication, the social interaction, and reduce the challenging behaviors.
Ms. Asha, are there any other therapies that we can do combining with ABA therapy?
Yes, combining ABA with other treatment modalities, it depends upon what the child needs. So we will see where the child is having delays, and based on that, sometimes ABA has to be combined with speech or occupational therapies.
What should we expect in terms of progress from ABA therapy?
See, the progression varies depending on each child. Some children, they develop gradually, while some others, they show immediate changes. So what is important is the consistency in therapy. Consistency is the key. So what we teach here, it has to be carried out in the natural environment also. This will bring out the maximum progression in our children. We always advise our parents to have a clear understanding about the goals so that this can be carried out at home also.
How can siblings or family members support a child with autism?
So siblings they can be very good role models. What we teach the parents also, how they can interact positively, reinforce the communication, and make the home a supportive environment.
Okay, this may be the most important question. Will my child ever be able to live an independent life or a normal life in the future?
You do not need to compare your journey to others. Most of the children with autism, they can live normal, independent lives. And that we have to do as early as possible also.
Now, what's your final message for parents this Autism Awareness Month?
See, as I told before, do not compare your journey to others. Each child, they shines in their own time, but it is always possible. So you stay involved, stay focused, and you believe in your child's potential. Definitely we can see the progression in our child, and this is possible with the love and support.